what happened was, and I'll tell you more about the story because we're not revealing names. This young lady was 17 years old, had been in and out of the state psychiatric hospital for years. And so it was so to the point where her behaviors were so big that we had to remove her from the adolescent unit. She was actually placed on the adult unit. Her behaviors were so big over there, they sent her back. And so when they sent her back, that's when we had that conversation with her. And her social worker said, "Can you come talk? Can you come talk with her?" That's how I got involved as an administrator because in some environments, you have the administrative side and you have the clinical side. And administrators dare not get involved with clinical. You dare not get involved with clinical. And so, because I had a good working relationship with the social worker and the clinical director at that time, they invited me to the table. In my clinical role, I oversaw programs, I oversaw the quality assessments on those cookie cutter treatment plans. So that's how I knew, like, I've been monitoring these treatment plans for years, and we see why we have the revolving door because we're not customizing to the individual. It took a 90-minute conversation with her. She had to get all her bigness out, let us know how she felt, and you didn't get the right to be upset about what she said. That's the thing. We don't get the right to be upset. That is their validated experience. And so, in listening to her, yeah, the social worker said, "Well, what are we doing? Like, is there anything?" So that was my first time hearing a social worker ask a patient, is what they called them at the time, "What do you need? What do you need?" And then, from an administrative standpoint, say, evidently, what we're doing is not working. It's just not working. When I tell you, she read her entire treatment team their rights. So this is how critical it was. We changed her doctor and her entire team because her experience before she went to the adult unit, nobody listened to her. And she said, "I cannot work with them. They won't even listen. I told them." She was, all the body moves, all the big behaviors. They didn't listen to me. And because they didn't listen to me, that's what they got. And I was like, we're listening.